Hey everyone, we are in chapter 12, axial muscles, appendicular muscles, chapter 12, slide 17. This is the third video in our series for this chapter. We're going over muscles of the pelvic girdle and the legs. We've already gone over the pectoral girdle and the arms. So since these muscles are found more inferior on our body, they're going to be larger and more powerful. They are carrying more weight. They have to deal with gravity. Legs are stronger than arms. We're looking at muscles that move your thigh, your femoral region, your leg, your feet, your pedal region, and your toes, your digital of the feet, phalanges of the feet. Starting with the gluteal muscles. I try to group these muscles together like we went over rotator cuff muscles. I try to group them based on location, function, so that they're easy to remember. And because they're related together, they're related to each other in some way. Similar attachment, similar region, similar motion. The gluteal muscles, there are 4 of them. 1, 2, 3, 4 that I'd like you to know. They're attached in the gluteal region on your butt. And they're all moving the same joint. They all move your hip, your femoroacetabular joint. If we look in this lateral view, this picture right here, there's a muscle that starts at the anterior superior iliac spine, attaches down. That's the meat of the muscle, the body of the muscle right there, what I just colored in. And its tendon attaches to the iliac crest, anterior superior iliac spine, and also its tendon goes all the way down to the tibia. It's a really big tendon. We'll talk about this in a second. This muscle is the tensor fasciae latae. It's a funny name. The fascia lata is this fascia that's in this region, and it's a muscle that tenses it up. It pulls it and stretches it. The tensor fasciae latae. That's why it has this funny name. Don't worry about the fascia lata. The tensor fasciae latae, this muscle, because of its anterior lateral location, not in the gluteal region, it can be for flexion, for bringing your leg forward, flexion of the femoroacetabular joint, abduction, put your hand on your hip and bring your leg out to the side. You can feel that contracting, and medial rotation at the hip, medially rotating at the femoroacetabular joint. Flexion, abduction, and medial rotation. A little bit more posterior, can you see my drawing in green here? Is this really, really large muscle. Very visible from a posterior view. This really large muscle attaching to the iliac crest and sacrum, and then to that really long tendon. This is the gluteus maximus. It's the large muscle of your gluteal region, gluteus maximus. Because it's more posterior than the tensor fasciae latae, it's for extension and for lateral rotation of the femoroacetabular joint. Extension is when you bring your leg posteriorly like this. Lateral rotation, bringing the whole leg outward. Both the tensor fasciae latae and the gluteus maximus, they insert into this really large tendon that's visible in this lateral view. So together, I'm going to color it in purple. This really large, broad tendon. This tendon is called the iliotibial tract. You might know this as your IT band. You might hear that it's important to stretch. It is. A lot of these are important to stretch, but because it's so big and thick and stretches all the way down your leg, it can cause issues. Iliotibial tract, because it goes from the ilium all the way down to the tibia. Tract, maybe not the best word here, but it's a tendon. Provides a good attachment point, and so you can cause all those motions: flexion, extension, abduction, abduction, and rotation. So there's a gluteus maximus. There's also two other sizes. Maximus is big. There's a medius, medium sized, and a minimus, small sized. It's located all in the gluteal region, but a bit different in what they do. Take a look. Let's actually look back up here, the top picture. Attaching along the peak of the iliac crest and then coming down here. That is the gluteus medius. If you look at the picture at the bottom, you can see the gluteus medius hiding a bit underneath the maximus. Here you can see more of the gluteus medius, and it's been cut, but it would be coming down this way. Can you see that? Let me change the color. That's gluteus medius. The smallest one is deeper, so you'd have to remove this. I'm going to erase what I have on the left side. The minimus is smaller, attached on the posterior side of the ilium, attaching down to the greater trochanter. That's a gluteus minimus, smallest one. Both the medius and minimus, because they're a little bit deeper, a bit more posterior, a little bit lateral, they can be used for abduction, just like the tensor fasciae latae, and medial rotation. So again, just like the tensor fasciae latae, those muscles work together of the femoroacetabular joint. If you want to see these muscles in action, you can start in this standing position and then bring your heel at an angle posteriorly. You're extending your femoroacetabular joint. That works the gluteus maximus, among others. To start here and end here, this abduction motion, using your gluteus minimus, medius, tensor fasciae latae. You can also use your tensor fasciae latae for this. This is an ab exercise, but also for rotation. You can see it being used right here for external rotation. Let me back up real quick. So we just saw how these muscles are for moving the hip, flexion for the tensor fasciae latae, extension for the gluteus maximus. So those are antagonists. For medial rotation for the tensor fasciae latae and the gluteus medius and minimus, and then lateral rotation for gluteus maximus. So those are antagonists. We see abduction here for the tensor fasciae latae, gluteus medius, and minimus, because these are fairly lateral on the gluteal region, on the gluteal femoral region. So if you're on the lateral side of your body, you can abduct when you pull and shorten. For adduction, you want to be on the medial side. So let's look to the medial thigh, the medial femoral region, for the adductor group. Adductor muscles are all on the medial side. We're looking at the right anterior view of a leg. 4 muscles that I'd like you to know. There's more, like there's this one here we're not going over. But there's this large muscle right here in green. It attaches as far down here as the tibia. You can't see it because it's hiding in back. But it's called adductor magnus because it's big. Magnus means big. It's more posterior, more deep. Adductor brevis. Brevis means short. It's shorter because it's more proximal. It attaches to the pubis and to that middle portion, the diaphysis of the femur. Adductor brevis. Adductor longus Longest means long, of course. It's longer because it goes more distally, has a longer extension. That's adductor longus. So those are the three muscles with adductor in the name. Magnus, wide, large, more posterior, more deep. Adductor brevis and adductor longus. There's one more muscle that's very medial. Attaches from the pubis all the way down to the tibia. This is slender and graceful. The word for slender is gracilis, gracile, gracilis. Because it attaches so far down, so far distally, it's also for medial rotation. All of these are for adduction, for bringing your leg closer together. This is also for medial rotation. So gracilis is the most medial of these four. Adductor exercises, you can do side lunges. That's definitely going to work your adductors. Wide squats, that's going to work your adductors and gracilis. We've mentioned these muscles before because they help flex the lumbar Z joints. But when you flex the lumbar Z joints, you're going to bring the hip with you, the femoroacetabular joint. The iliopsoas group, which includes the iliacus sitting in the iliac fossa. Whoops, wrong way. There we go. The iliacus and the psoas major. These insert into the lesser trochanter of the femur. Because they insert into the lesser trochanter of the femur, when they pull, they shorten, they cause flexion of the femoroacetabular joint, in addition to flexion of the lumbar Z joints. So you can see the use of iliopsoas when you start straight-legged, and then you bend when you flex at the hip, flex at the femoroacetabular joint. Straight-legged, you're coming up this way. More distal, still in the thigh region, but more anterior. We have four muscles. Together, these four muscles are known as the quadriceps. It's four-headed muscle group in the femoral region. It's a four-headed muscle group in the femoral region, quadriceps femoris. The four muscles are listed here. The rectus femoris, rectus means straight. We've seen this before with rectus abdominis. Rectus femoris is, if we're looking at this picture, it's actually not shown, but it would be sitting right here. In this left lateral view, it's right here. In this anterior view, you can see it. It's here. It directly connects down to the patella. Its tendon goes down to the patella, that quadriceps tendon. If I clear what I drew, what I colored here on the first picture, we can better see the other muscles. The most medial of these four is vastus medialis. Vastus means big, vast. It's a medial one. The one in the middle and deeper, it's a deep to rectus femoris. This is vastus intermedius. And then most lateral one is the vastus lateralis. The vastus lateralis, if you look at this left lateral view, it's hiding a bit underneath that iliotibial tract. The vastus lateralis is large, lateral muscles. So you can see it from a posterior view as well, as we'll see coming up. These muscles, because they're on the anterior side of the femoral region, they insert down to the patella, insert down to the patella, which then connects down to the tibia, because you have that quadriceps. Write this down. You have the quadriceps tendon. Which is attached to, oh, here it is, to the patellar ligament. It's for extension of the tibiopatellofemoral joint, extension of the knee. In addition to extension of the knee, extension of the tibiopatellofemoral joint, you can also use these muscles to flex the femoroacetabular joint. Let me show you what I mean by that. In doing this kind of ab exercise, you can use your abs, you can use your iliopsoas, because that causes flexion of the lumbar Z joints and flexion of the femoroacetabular joint. You will also use your rectus femoris and your quadriceps to do this motion. You start flat and end here. So it's not only for extension of the knee, of the tibiopatellofemoral joint, but also for flexion of the femoroacetabular joint. Did I say that right? Extension of the tibiopatellofemoral joint, flexion of the femoroacetabular joint. And here you can see that flexion, extension. You start with your knee bent. So here the knee is bent, the knee extends. Start with a bent knee, leg extends. So jumping, squatting, the motion where you're coming back up, that's using the quadriceps. The rectus femoris, vastus medialis, vastus intermedialis, vastus lateralis. That's on the anterior side of the femoral region. On the posterior side, this group of muscles is known as the hamstrings. I think it's called hamstrings because people thought it looked like, might have to do with ham being strung up, but anyways, that's what it's known as, hamstrings. But you should know the names of the three muscles here in the back of the leg. Let's orient ourselves a little bit. Here's that left lateral view. Here's the iliotibial tract coming down, which means we have the vastus lateralis hiding right here. And from a posterior view, you can see vastus lateralis. The most lateral of these hamstrings is biceps femoris. This is why you need to say the full name. It's not biceps brachii. It's biceps femoris. There are two heads, hence biceps, and it's a more lateral of these three. The next two have long names. The one that's sitting on top, and it's slender, is semitendinosus. Semitendinosus is on top. Semimembranosus, pick a color. Semimembranosus is wider and flatter. It's It's wide and membrane-like. And it's also the most medial because you see it peeking out right here. We can better appreciate this in complete anatomy, so that's what we're going to do in a minute. 3 muscles of the hamstrings group. They all are for flexion of the tibiopatellofemoral joint, so they're antagonists of the quadriceps. Hamstrings are for flexion, for bending your knee. They're also for extension of the femoroacetabular joint. So again, they're opposite antagonists of the quadriceps group. Let me show you what I mean. Down here, we have our standard hamstring exercises. The leg is straight, then you bend your knee. So we've brought our knee this way. We've flexed the tibiopatellofemoral joint. In this picture, let me change colors. In this picture, look at the hip. The hip is bent here, and we're flattening out. We're extending our what do you call it? We're extending our femoroacetabular joint. We're extending our hip. So it's reflection at the tibiopatellofemoral joint and extension of the femoroacetabular joint. Both of those things. Let's take a look at complete anatomy at these muscles. Starting on the gluteal region. Here you can see tensor fasciae lati. There's tensor fasciae lati. It attaches to the tibia with that iliotibial tract. Iliotibial tract goes all the way from the ilium, iliac crest, down to the tibia. Also attached to this is a gluteus maximus. There's a gluteus maximus. You can see the gluteus medius a little bit, but we'd have to dissect out the maximus to see it better. So let's do that. There's gluteus medius, attached to the greater trochanter. Gluteus minimus, we have to hide the maximus to see it. So let's do that. Actually, we have to hide the, well, you can see it peeking right here. Here's gluteus minimus. Let's isolate it. Smaller, deeper to gluteus medius. If we go to the adductor group, I'm going to remove this muscle here. It's called the sartorius. We're going to go over that in the next video. Actually, we're not. We're going to go over it right now. Let's go over it right now. So this really long muscle is called the sartorius. It's really long. It attaches from the anterior superior iliac spine. Comes anteriorly, then medially, and crosses over to the tibia. It's the longest muscle in your body, the sartorius. Because of its unique shape and length, it's good for crossing over your legs. So let me actually switch back to the slides. Slide 28. The sartorius, this can do many things. You can flex your tibial-patellofemoral joint because of its medial location. It also flexes your femoral acetabular joint, so flexes your hip, abducts your hip, and laterally rotates your hip. The reason why it's called sartorius, the word sartor means tailor. Tailors back in the day, and who knows now probably, sit cross-legged to do their work. If you're familiar with these poses, here's tailor's pose and half tailor. To make that crossing motion, use your sartorius. Again, it's the longest muscle, originates at the anterior superior iliac spine, and then inserts into that medial proximal part of the tibia. You can, a common exercise, well, common enough, I guess, in workout classes, is this bicycle. When you do bicycles, in addition to other muscles, you're using your sartorius since you're pedaling back and forth. Back to complete anatomy. That's a sartorius. I'm going to hide it so that we can better see some of these other muscles. I'll actually go over the femoral muscles first, the anterior femoral muscles, the quadriceps, and then we'll hide these to show the adductors. Here's rectus femoris. And you can see how it attaches to the quadriceps tendon, which attaches to the patellar ligament. If I hide quadriceps, if I hide rectus femoris, then we can see the other three more easily. There's vastus medialis. Vastus intermedius. Did I say intermedialis last time? Vastus intermedius. And vastus lateralis. Look at how vastus lateralis is hiding a bit underneath the iliotibial. It's hiding a bit underneath, deep to the iliotibial tract. There we go. I'm going to hide vastus medialis so we can see the adductors better. All right, anterior view. You can see adductor longus. Adductor brevis. And hiding behind those two, you can see it peeking on the top and on the bottom. Here is adductor magnus. Magnus is wide, long muscle, hiding posterior deeper to adductor brevis and longus. And then medial to all of that, long and slender muscle, is the gracilis. Attaches all the way down to the tibia. There is a gracilis from a posterior view. Adductor magnus from a posterior view. Vastus lateralis from a posterior view. Moving on to the hamstrings muscles. Here's biceps femoris. This is just showing one head. Here's the other one. It's hiding. And there's the short head. So there's one head of biceps femoris. There's the other head. Semitendinosus is on top. It's long and tendon-like, attaching from the ischial tuberosity down to the tibia, medial side. Semimembranosus is hiding underneath it. You'll see this is a common theme where you got one muscle on top of another that do similar things. Let me isolate it so you can see it better. That's semimembranosus. Semitendinosus is on top. There's semitendinosus. All right. One more video looking at some muscles in the crural region. We're not going over muscles of the feet. So look out for the next video. Let me know if you have any questions. Thanks for watching. See you later.